Not long from his experiences as a Civil War physician, Dr. Charles Hewitt stepped off the boat in Red Wing in the spring of 1867 to begin an even longer battle against death, disease, and injury in the rapidly growing state of Minnesota. Over the next 43 years, Dr. Hewitt changed the face of medical care and public health in Minnesota. He helped start a medical school. He was a founder of the State Medical Society. He edited one of the first medical journals in the state. And most importantly to me, he created a state board of health, the third such board in the country. No one has had more influence on the health of Minnesotans than Dr. Charles N. Hewitt. So we're going to focus on his life and his accomplishments on today's episode of A Public Health Journal.
Welcome to A Public Health Journal, a program that explores public health issues facing our society today and tomorrow. The host of the show is Dr. Ed Ellinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health and the Hennepin County Human Services and Public Health Department, all working together towards the goal of healthy people living in healthy communities.
Welcome to this special edition of A Public Health Journal, coming to you today from the Goodhue County Historical Society in Red Wing, Minnesota. In January of 2013, the city of Red Wing named one of its streets after Dr. Charles N. Hewitt, an early resident of the city who changed the face of medical care and public health in Minnesota and throughout the country. Dr. Hewitt was the force behind many of the changes in public health and medical care that still influence us today. Among other things, he helped create a medical school. He helped establish the State Medical Society. He edited one of the first medical journals in the state. He developed the first public health curriculum at the University of Minnesota. And he established the State Board of Health, which is now called the Minnesota Department of Health. Dr. Hewitt served as Secretary of the Board of Health for 25 years. Obviously, he was a remarkable man. Today, we're going to learn more about Dr. Hewitt and his impact on the state. To help us with that task, I've invited Char Henn, Executive Director of the Goodhue County Historical Society, to join us. Char, welcome to the program.
Thank you for having me. Thank you for visiting us.
Well, and thank you for the invitation to come down here. It's really a pleasure to be here in Red Wing and the Historical Society, which I understand you have some artifacts, at least one major artifact of Dr. Hewitt here in the building.
Yes, we have his operating table in our collections, and it's currently on exhibit.
Oh, good. Now, let's give a little history. Why in the world did Dr. Hewitt come to Minnesota, and particularly, why did he come to Red Wing? He was a pretty well-known surgeon out east. He did a great job during the Civil War. Why did he choose Minnesota?
He had gotten a letter from a doctor who was already in Red Wing, Dr. Augustine Hawley, who had gone to school with Dr. Hewitt. They'd both gone to Hobart College. And the rector of the Episcopal Church here, Edward Wells, was also an alum of Hobart College. Dr. Hawley had decided to purchase part of a drugstore and give up his practice and go into the pharmacy field. And so he wrote to Dr. Hewitt and asked him to come and take up his practice. Dr. Hewitt visited Red Wing, and although Red Wing was at that time a bustling city of 3,000 people, it had some serious sanitation issues. And I think Dr. Hewitt saw that as a challenge, and he decided he needed to come and stay in Red Wing and work on sanitation and public health here.
So when he came, I know that in reading the history of it, it sounds like he learned an awful lot in the Civil War that he then brought to his practice. What were some of the things that influenced him during the war as a war surgeon that brought him here and that he started to implement in the practice here in Minnesota?
Well, backing up a bit, his father had been a doctor, and he started as a child working with his doctor and helped with his father, and had performed part of an autopsy when he was 13 under his dad's supervision. And he had developed an interest in health at that point and wanted to go to the medical field. And then as a surgeon in the Civil War, he noted that cleanliness was an issue. And he seems to have been just kind of that sort of a person, a tidy person. And it seemed sensible to him that if you kept your workspace tidy, you could keep down germs and infection. He compared germs to grain, how germs won't grow if they don't have the right environment. Grain doesn't grow if it doesn't have the right soil. So if you make the environment you're in inhospitable, you won't have germs.
So when he came here, did he just set up an individual practice, or was he in a joint practice? How did that work?
He took over Dr. Hawley's practice, And one of the things that did guide him was a saying by Benjamin Franklin, public health is public wealth. And he kept,
I'm going to have to remember that one.
yes, it's a nice pithy statement. And he immediately started, when he got to Red Wing, there were problems with cholera, dysentery, children had measles, whooping cough, and he noticed that privies were often quite close to wells around here. And in the bustle of Red Wing, things were being done wherever. Butchering was being done in the streets sometimes. And so he thought, we clean this up, we have a healthier community. And so he started to get busy.
Now, in today's world, a lot of the public health regulations come through the legislature or city councils. Did the same thing happen back then? If you wanted to move privies, was it a city rule that made that happen, or did he just, by force of will?
It was more a grassroots movement, and then once he had the ideas in place, then he would go to the authorities, like with starting the state medical board, the Board of Health. He went to a medical society meeting first, got the ideas in practice, then he went to the legislature, and then worked on getting that public Board of Health.
Yeah, so we'll get to that piece. But Red Wing, was that sort of one of the epicenter of medical care in the state, right? Yeah, I mean, obviously right now Rochester and the Twin Cities are thing. Was that a big medical hub at that point in time for the state?
Red Wing was a big hub. It was one of the dropping off points. Boats would come, immigrants would get off, or settlers from the east would get off. They'd stay in Red Wing, or they would move west. So there was a lot of people coming and going, and one of the things that happened, he came in 1867. In 1868, there was a boat of Finnish immigrants, and they had cholera on the boat. The captain wanted to put them off in Red Wing. The city fathers were frightened of the cholera, and so set the boat adrift. When Dr. Hewitt heard this, he was incensed, and he hired a boat to take him out to the Finnish immigrants, and they set up a base on one of the islands in the river. And he treated the cholera victims, shamed the city into providing funds to help them. The city was willing to do that because they were no longer a threat to the city. And he stayed there and treated them until they were recovered and could move on. There are some people who were buried on the island, but many of those Finnish immigrants went north and are now part of the Great Iron Range communities.
So he started a quarantine office.
He did.
Which, even before the national quarantine efforts became. Are there other stories here in Red Wing that we may not know about in the history books, things that you know because of your research here in Goodhue County?
When he went in the late 1880s, he went to Europe to study with Louis Pasteur in France, and then he also studied in England and spent some other times in a few other countries. When he came back to set up his smallpox vaccination areas, he started here in Red Wing, and he went a little bit out of town near a dairy farm where he was getting young calves for use in making the vaccination. And one of his young neighbors, a 14-year-old girl named Maude Allen, was persuaded to be inoculated 4 times so that she could prove to all the people who were frightened that it was not a big deal and it was fine to go ahead with. And so she lived a long life, so it worked for her. And then Dr. Hewitt, he would travel all over the state. As part of his work with the Board of Health, he was trying to form local boards of health, and so he would go, and there's a story about him visiting a monastery, and he was kept waiting for over an hour because the monks didn't think vaccination was a good idea, and he kind of rebuked the abbot for his lack of hospitality because that was part of the pillar of the brothers. And then he was let in and had a meal, and one of the monks then got up and read a paper on how inoculation was not only useless, it was wrong. And he listened to it, and then he said, well, if I, as a doctor, can listen to a theologian expound upon medical practices, I think it's time that I give you a discourse on theology. And they then decided to be inoculated.
A good theological argument for vaccination. Great. Well, I want to talk a little bit about this whole establishment of the state health department and the boards of health, but we need to take a little break.
Sure.
We'll be back right after this message.
Body language can tell you all sorts of things. Like someone is having a stroke. Know the sudden signs. Learn fast. Face drooping, arm weakness, speech difficulty. Time to call 911 and get them to a hospital immediately. Learn the body language and spot a stroke fast.
Welcome back. We're talking about the life of Dr. Charles Hewitt, who was the initiator of the State Board of Health in Minnesota. And we're talking with Char Henn, who's the executive director of the Goodhue County Historical Society. Char, let's talk about sort of his major impact in public health, and that's the establishment of the State Board of Health. How did that come about? What were the factors that prompted Dr. Hewitt to really work on this issue?
I think he really cared about people and wanted people to live long, healthy lives. And his studies had shown him that working in cleaner situations, taking care of some of the environmental issues, could lead to healthier lives.
And were there local health departments at that point in time, boards of health throughout the state?
I believe so. There was nothing there was no overarching board, and so therefore all of the regulations were up to each individual board.
And I know that he worked with the State Medical Society as he really tried to organize them and got them to pass a resolution saying we need a State Board of Health. And then it was a few months after that, in March 4th of 1872, that the state legislature really passed that. Pretty fast movement. Was that the kind of man that he was?
It is, and I think he, to a certain extent, ate, breathed, and slept public health. When he married in 1869, he married a cousin of Dr. Hawley, who had brought him to Red Wing in the first place. Their honeymoon was a trip to New Orleans, where he could attend the American Medical Association convention.
Oh, he probably went because he had got his way paid by the practice.
And apparently they did do some sightseeing, but I think
was that one of the reasons why he came to Red Wing? Was there a love interest in there that brought him here, or did
that
he meet...
came later? Helen was 14 or so years younger than he, and she had come to be a school teacher at the Episcopal Church, mostly music.
So when Dr. Hewitt started the State Board of Health, how did he spend his time? Did he spend most of it here in Red Wing? Did he spend it in St. Paul, Minneapolis? How did he divide his time, and what did it do to his practice?
He had 3 goals when he started the Board of Health. He wanted to form local boards of health throughout the state so that everyone had access to good healthcare information. He wanted to start a medical journal, and he wanted to start vaccinations, especially against smallpox. And so he did an awful lot of traveling throughout the state to work with the local health boards as they were being formed. And he then worked very hard on his public health journal, which he did publish here from here in Red Wing for 9 years. He traveled to St. Paul when he had to, and when he did teach at the university, he did travel back and forth to St. Paul. But when he was home, you could see him walking around town or riding his favorite horse, Fanny. But when he was called out at night, he generally walked and carried a lantern to wherever he was needed.
So he continued his medical practice at probably a lesser degree. Did he have other partners at that time?
There were a number of doctors, and they collaborated. There weren't any real strict partnerships at that time. Red Wing was a bustling town, but not as organized probably as some of the larger cities were.
And then he had an influence at the University of Minnesota also, didn't he?
Yes, he started the public health department of teaching and was the first professor for the public health field there. As secretary of the Board of Health for 25 years, he worked with the medical school at the university, and that indirectly led to his not being reappointed in 1897. Some of the faculty at the medical school didn't think he had been as cooperative or collaborative as they had wanted him to be, and so the governor at the time did not renominate him for secretary. And I think that is one of the characteristics of Dr. Hewitt. He was going to do what he thought was right, whether it was politic or not.
So as you read through it, his history, what kind of a person was he? What kind of personality did he have?
He was a probing sort of man. I think he was always on the lookout for more information, especially in public health. That was the overall consuming passion. But he was very active in the community, very active in the Episcopal Church. He organized a boys' choir, and they practiced every night in the Hewitt home. And it took quite a lot for them to be able to sing at the Episcopal Church, much to his dismay, because the choir had not been formed by the rector or some of the deacons in the Episcopal Church, and was formed by just one of the congregation members. It wasn't considered appropriate to let them sing in the church. And he finally got that changed.
So was he a fun person to be
I
with?
think so.
Or was he sort of domineering? What kind of reputation did he have?
There are pictures of him where you can see a definite glint in his eye. I think he enjoyed fun, he enjoyed children, and it all comes back to his interest in public health. He wanted children to be happy and healthy and enjoy their lives, and he wanted to be there to enjoy the lives of his children.
And I know one of the other things that was really important at first is he developed the first public health lab. And did that occur in Red Wing?
Yes, and that was also considered, he had a small building that he used for a hospital too, which may have been the first hospital here in Red Wing. And the building still exists, it has been moved and is now a private home.
Yeah, because as I was reading up, I was really surprised to see that he had the first public health lab in the country, and it was here in Red Wing, so another first. Well, I'm going to talk a little bit more about his influence, what you see as his influence both locally, in the state, and nationally, but we need to take another little break.
Thank you.
We'll be back right after this message.
Dad can be tough.
No. What do you mean she's not coming?
When's the fairy princess coming?
Any minute now.
But when you're willing to do anything,
It is I, Cruz Zinkelbell. Okay, time for cake.
it's always worth it.
I know it's really you, Drew. I'm just pretending for the other kids.
The smallest moments can have the biggest impact on a child's life. Take time to be a dad today. Call 877-4DAD-411 or visit fatherhood.gov.
Welcome back. We're continuing our conversation about Dr. Charles Hewitt with Char Henn, who is the Executive Director of the Goodhue County Historical Society. Char, what kind of impact do you see now, 150, 140, 50 years later, the kind of impact that Dr. Hewitt had on healthcare, both medical care and public health, here in the state of Minnesota?
I think it's rather obvious. We have one of the best healthcare systems in the country. We have all of the fine resources at the University of Minnesota, and we have the Mayo Clinic. And when Dr. Hewitt passed, his medical library became part of the nucleus of the Mayo Clinic's medical library.
And weren't one of the Mayo Brothers contemporaries with
Yes.
Dr. Hewitt?
And I'm sure that they probably had discussions because one of the Mayos had a boat that he would bring up to Frontenac, which is only 10 miles from here, during the summer. And I would very much guess that they were in communication. And I think that Dr. Hewitt was the example that we now aspire to emulate as we work with public health and making Minnesota as healthy as it can be.
Yeah, well, I certainly aspired to have the kind of influence that
We've
Dr. Hewitt had.
We've gone past the days of advertising Minnesota for its bracing, healthy invigorating air for people coming from the east for tuberculosis or for whatever reason. Henry David Thoreau came to Red Wing in 1861 for the air, and I'm not sure it helped him because he died the next year. But Minnesota is still a
We
great...
won't tell that story.
Minnesota is still a great place to live and to work, and part of that is because Dr. Hewitt was so particular about cleanliness and sanitation. He was known in the Civil War as one of the best regimental surgeons in the Army of the Potomac. And that was because of his insistence on sanitation issues.
And what kind of influence did he have nationally? Because I know that he was the president of the American Public Health Association for a year. What do you see as you're looking at the literature, the kind of impact that he had nationally?
I think that his impact is really with vaccination, inoculation. He had the first inoculation lab west of the Alleghenies. He really brought preventive medicine, I think, to the minds of the medical profession. Rather than treating the disease after it happens, why not prevent it?
Yeah, well, in my closing comment, I'm going to be talking about, prevention first. Treat if you must, but prevention first.
Public health is public wealth.
Yes, that's good. So in the last few minutes that we have, tell me a little bit about the Historical Society. And this is a wonderful facility with lots of things that people can see. Tell us a little bit how it got started and what kind of things you have here.
Well, it's an interesting coincidence, but the Goodhue County Historical Society was founded on May 4th, 1869. So just a few years before the Board of Public Health. And we are the oldest county historical society in Minnesota. We have well over 250,000 objects in our collection, including a 1/4 of a immigrant cabin from the western part of the country and the county. And while Dr. Hewitt had a more substantial home, his home had an organ. He was quite a musician. Many of the settlers would be living in a cabin similar to this, at least at the beginning, until they could build a better home. This is where they would start. We have in our collection Dr. Hewitt's operating table. We work on history from prehistory with the wonderful Mississippian culture that settled here, all the way to today. And we focus on not only people, but events and places. We highlight the things that the residents think are important in our township exhibits. We ask the township residents to let us know what they think is important to discuss, and then we work that into our narrative of the township history.
Just as I'm here talking about Dr. Hewitt and his impact on the health of the state, even now, 142 years after he started the state health department, history is really important to healthcare. Does this community, Red Wing, Goodhue County, see history as important to influence how it develops into the future?
It does. Red Wing is very history-minded. They have a very active historic preservation commission. And I think you can also see that in the renaming of the street after Dr. Hewitt. The street is the road that goes to our Mayo Clinic. And so to name it after such a wonderful pioneer of medicine is really, I think, ideal. We tend, as a city, to do that when we have new housing developments, we have assisted living. We tend to look at the community and how it has formed. A new one being developed is St. Crispin's Assisted Living. And St. Crispin is the patron saint of shoemakers. So if you know your Red Wing history, you know Red Wing shoe is key to our community. And so we will try to find things that will honor what makes our community strong.
Yeah, well, I was so pleased to see them name a street after Dr. Hewitt, because it just revisited in me the importance that he had not only in this community but throughout the state.
Right.
In the last minute that we have, anything else that you'd like to add that we didn't talk about, either about the Goodhue County Historical Society or Dr. Hewitt?
I think Dr. Hewitt needs more investigation. I think he is worthy of a biography. I have not seen one. I think you can't have public health in Minnesota without Dr. Hewitt. And I think that you need a historical society like ours not to just look at the past, but to use that as a way to develop the future.
Great. Well, Char, thank you for inviting us down here to be in this beautiful studio in the Historical Society.
Thank
and
you.
for all of the history about Dr. Hewitt. He was an important man, obviously, in the state and in the city. And so thank you for this information.
Thank you for having me.
Good. And I'll be back with a closing comment right after this message.
Jack Frost, you do have beautiful teeth.
My what?
Are they really as white as they say? Yes. Oh, they really do sparkle like freshly fallen snow. This is an excellent example of what teeth should look like. Check out the iridescence of that incisor, the beauty of that bicuspid, the magnificence of those molars. And the best way to achieve such terrific teeth is brushing. 2 minutes, twice a day. Not 30 seconds, not a minute 45. 2 minutes. That's all it takes. They're beautiful.
For a community to be healthy, there certainly needs to be a high-quality medical care system to treat illnesses, diseases, and injuries. But we now know that medical care only impacts about 10% of our overall health. It's the environmental and social conditions in the community and our own lifestyle choices that make up most of the other 90%. If we are to maximize the health of everyone in our community, we need to find ways to effectively address all of the determinants of health, not just the medical ones, which now consume about 95% of our overall healthcare resources. We need to rebalance our investment in both treatment and prevention. We need to find a way to integrate medical care into a broader public health framework. Dr. Charles N. Hewitt knew the importance of both medical care and public health, and did consider medical care to be a component of public health. He said, quote, "The matter of medical work is constantly on my mind. If we can develop medical education systematically, a grand future is before us. My plan includes not only developing medical education, but the resting of that in the Department of Public Health, which is more and more admitted the foundation of practical medicine. Prevention first, cure if you must, capacity to do in both directions," end quote. Although those words were spoken over 120 years ago, they are truer today than ever. If we're going to improve the health of the entire population, improve people's quality of life, and reduce costs, the triple aim of health reform today, we must follow the advice of Dr. Hewitt. He knew what Minnesota needed to do 140 years ago. I think he also knew what we need to do today. Prevention first, cure if you must, capacity to do in both directions. That's all for today. Thanks for watching. I hope you can join us again next time on A Public Health Journal.